in Kensington and Chelsea, which has been mentioned. I noticed it in the report. It says, it quotes Councillor Robert Freeman, who was then the scrutiny chair on these issues and is now the mayor of Kensington and Chelsea, that, quote, there was very little public awareness of the proposals in his borough. I think that's largely because there's been very little leadership from Kensington and Chelsea Council on these matters, because by and large the proposals have left Kensington and Chelsea alone. Chelsea and Westminster is one of the hospitals that is gaining from the threat to Charing Cross Hospital, which we oppose as much as you do. I have actually written reports on various aspects of this, including to Shaping Our Healthier Future, objecting to the proposals right from the beginning. However, although the majority on Kensington and Chelsea did have very severe doubts about what was happening or likely to happen at Charing Cross and indeed at Chelsea and Westminster, which they could see might very well be overwhelmed if Charing Cross was closed down. Nevertheless, they got a sufficient little bits and pieces from the Shaping a Healthier Futures team that they went along with it, because of course it's in line with the official government policy. It's been very difficult in those circumstances to get any kind of local campaign going, although whenever we've held street stalls, as we have done in the north of the borough, people have come up to us. We've talked about TTIP as well as this, and people are very enthusiastic at signing petitions, but it really is an uphill struggle because there's so little leadership at the top. But last night I did propose a motion on this at my local constituency Labour Party AGM, which went through, which is basically committing our CLP and the Labour group to joining in this campaign and doing all we can to help save Charing